Nigeria's COVID-19 tally stands at 190 as Osun records 6 new cases. Vice President Yemi Osinbajo says President Buhari's government is facing an unprecedented challenge with COVID-19 pandemic. On the international front, global coronavirus cases rise above 1 million as Spain claims 1/5 of the world's 50,000 COVID-19 deaths. And in sports, John Mikel Obi set to join Brazilian club Botafogo.
This is ANN News.
I am Olajumoke Olatuji. COVID-19 numbers in Nigeria have been increasing these days with blinding speed. Just last night, 10 new cases were reported in Lagos and Abuja. But this morning, the number had risen, jumped by 6 more cases confirmed in Osun by the Nigeria Center for Disease Control. For now, the total number of cases stands at 190. Of course, it will change before we end this broadcast. NCDC says 20 of the cases have been discharged and 2 have died. Meanwhile, Jigawa State is preparing for the possibility of coronavirus cases hitting the state. As of now, no cases have been reported there, but the government is converting the National Youth Service Corps orientation camp and a 3-star hotel in Dutse into isolation centers for the pandemic. Governor Muhammadu Badaru said the state could least afford to be complacent, so it has taken the measures to prepare to manage any outbreak of the epidemic in the state. And Akwa Ibom State has begun a 14-day lockdown ordered by Governor Udom Emmanuel on Thursday evening. The lockdown calls for total cessation of movement and it prohibits all events in the state during the period. The governor gave the order after 5 suspected cases of COVID-19 were confirmed in the state. Governor Manuel said the suspects are mostly healthcare professionals in good health with no symptoms. He said they have been moved to the state's isolation center for proper management. The governor said relevant security agencies will enforce compliance with the lockdown directive. The country's number 2 citizen, Professor Yemi Osinbajo, says the Buhari administration was being faced with a challenge that no government in Nigeria's history had ever confronted. The vice president made the remarks at the inaugural meeting of his new committee, the Economic Sustainability Committee, of which he was recently appointed chairman by the president. Professor Osinbajo said this current unique challenges means the country would have to redesign its economic planning and change its thinking. The committee was assembled to design and respond to the impact of the COVID-19 pandemic. It is also saddled with the responsibility of coming up with a sustainable plan that would keep the economy going in the face of crashing oil prices in the global market. Coordinator of the Presidential Task Force on COVID-19, Dr. Sani Aliyu, has asked the country not to worry about how the billions of naira being donated by private individuals towards the fight against coronavirus pandemic is being utilized. Aliyu said the task force is aware of questions and speculations about how the government is spending and channeling the funds. During Thursday's daily briefing, Dr. Aliyu explained that the donated billions are not stored in government coffers but in a separate private bank account that is not tied to the federal government. He said this is a private sector fund and is run through the coalition against coronavirus disease. Delta State government has reacted to yesterday's killing of a 28-year-old man, Joseph Pesu, in Warri, allegedly by an unknown soldier who was said to be enforcing the coronavirus lockdown in the state. The deceased was shot dead in the early hours of Thursday by the yet-to-be-identified soldier. The government said in a series of tweets on Thursday on its official Twitter handle, it was called for immediate investigation of the incident. The tweet announced the commencement of the investigation and expressed the government's worry about the reported killing. The tweet also said the government has sent a delegation to condole with the family of the deceased. It's also said military authorities have been contacted to carry out an immediate and thorough investigation into the killing. Deputy Senate President Ovie Omoagege has also condemned the act, which he described as extrajudicial killing. Nigeria's measures to combat coronavirus includes constant hand washing and social distancing. Hand washing would be effective if water were available to carry out the exercise. As Phil Ihaze reports, many find it difficult to do this simple chore because they have no access to clean water.
Unclean sources of water like this are common in rural Nigeria. Health experts are now warning that if Nigeria has a hope of combating coronavirus, it urgently needs a supply of clean water for everyone.
We are now at a period where the whole world is ravaged by coronavirus, and the simplest and most effective means of preventing coronavirus is hand washing, and with soap and water. So access to water is not negotiable. Governments have to wake up to their responsibilities and make water available for people in order to be able to wash their hands.
An estimated 55 million Nigerians lack access to safe water pumps or reservoirs. That's according to WaterAid Nigeria. While 75% of the urban population have access to treated and better quality water, only about 42% of households have access to safe water in rural areas. Experts say the central government alone can't tackle the problem. It requires a more collective effort.
This is the time where we need to come together. Management and prevention of coronavirus is everybody's business. So it is good that you are bringing this up. So NGOs, international organizations, charity organizations should come up with a way of providing water to those communities that lack access to water.
The Nigerian government recently secured a loan for various water projects worth over $124 million from the African Development Bank. The plan is to roll out universal access to water and sanitation by 2030.
Nearly 200 million people in Nigeria are at risk of coronavirus if nothing is done to provide them with water supplies. And while the government is urging them to wash their hands, it's not going to be that easy for people who don't have access to clean water.
Coming up, African stories. Egypt's central bank limits cash withdrawals and deposits to curb transfer of virus through banknotes. And later, international news. Global coronavirus cases top 1,050,000 deaths.
You are watching ANN.
We are on the road every day, canvassing throughout Africa for news you really need. We follow this story everywhere, from every corner of Nigeria to the wide African expanse. We bring you what's making headlines. We connect you with news you can use. ANN, African News Network, in a truly African spirit.
Welcome back. This is ANN News. In an attempt to add extra steps to combat the coronavirus pandemic, Tunisia has begun disinfecting all public areas in the capital, Tunis. Reporter Avni Chawoji says the government wants to ensure it does everything in its power to curb the spread of the disease.
Authorities have set up a dedicated team to disinfect and sanitize streets and public areas as a precautionary measure to contain the spread of coronavirus.
The large-scale disinfection campaign aims to contain the spread of the virus and to provide proper conditions for the epidemiological situation to improve. All state officials and agents are dedicated to this special mission.
The streets, parks and public places were emptied in the capital city Tunis. Meanwhile, the Interior Ministry deployed thousands of agents and modern equipment for the large-scale disinfection operation.
Water cannon and anti-riot vehicles are mobilized for a different purpose. It's a cleaning and disinfection mission. We want to sensitize citizens to the importance of the fight against coronavirus.
The operation continued for 24 hours around the clock. Tunisians woke up to clean and sanitized urban spaces.
It's both unusual and important to sanitize the city because millions are using public transport and they share public spaces. As citizens, we support the state in this national campaign to fight the coronavirus.
Experts at the National Observatory on New and Emerging Diseases shed light on the link between public transport use and the spread of the disease. All trains and buses were disinfected. Tunisians have welcomed the large-scale disinfection efforts and encouraged municipal agents and security forces. Authorities say the national campaign will continue. Municipal agents will also disinfect banks, public buildings, police stations and markets.
Egypt's central bank is thinking out of the box. It has put a cap on amounts of cash that can be withdrawn or deposited in an effort to limit the transmission modes for the Covid-19 pandemic. It believes if fewer notes are handled, less transmission would occur from notes already touched by infected persons. Adil El Marouki has the details.
The governor of the Central Bank of Egypt, Tarek Amir, says the temporary cap set over cash deposits and withdrawals is to discipline the cash flow. During the past 3 weeks, Egyptians have withdrawn nearly $2 billion from banks, an alarming figure according to Amir. CBE has also cited fears of COVID-19 infections through banks.
The central bank is concerned about the virus's spread through paper banknotes. The CBE also says this restriction would limit the flow of individuals to banks. Some are seeing it as a right decision in the wrong time. Definitely, bank clients must have been given a buffer period. The CBE was flexible to provide some exceptions, but I still don't understand the cap enforced on deposits.
On the contrary, long queues at many banks could be seen following the announcement. For individuals, a cap for deposits and withdrawals have been set to just around $640, while ATM transactions are half that amount. Corporations are restricted to only $3,200, with exceptions given to payrolls payment and check deposits.
Definitely there are unannounced reasons for the decision, one of which could be to control expected spikes in inflation. Food and nutrition products represent a significant portion of the inflation basket. These restrictions lead to limiting unnecessary buying and therefore control prices of some goods.
The Central Bank of Egypt has not announced any time frame for this cash cap. No further restrictions have been announced over non-cash transactions. The CBE's announcement follows an earlier decision to cut rates by 300 points, a move that aimed to revive the business environment in Egypt. With its cash flow restrictions, the CBE has provided stimulus to the market with one hand and took it back with the other.
The Somalian government is also not just sitting on the fence as regards COVID-19. It is ramping up measures to contain the spread of the disease. Abdulaziz Bilo tells us what the government is doing.
This medical team is tasked with leading an awareness campaign on coronavirus in all 17 districts of the capital. They are mostly public health students from some of the city's leading universities. The initiative, that's backed by the local Mogadishu municipality, targets close to 3 million city residents. Among them are thousands of displaced persons living in makeshift camps across the city.
The awareness teams will reach all districts of the capital, especially displaced camps. Internally displaced persons remain vulnerable compared to other members of society. Prevention is better than cure. This is the message we are seeking to spread.
On the outskirts of Mogadishu, thousands live in deplorable conditions in camps like these, home to those who fled conflict and climate-related challenges. Most of them know little about the coronavirus. Health experts warn that it may be impossible to stop the spread of the virus in such places.
We have set up mobile units in vehicles to spearhead awareness campaigns. We have received support from university students. Our health department is ready to focus on educating the public, especially the most vulnerable people living in displacement camps, on ways to protect them.
The country has several confirmed cases imported from COVID-19 hotspots. However, amidst the global pandemic, one of the first cases recorded in Somalia has left isolation after testing negative. 3 other cases have also been released from quarantine after completing the 14-day mandatory quarantine period. On Monday, the Somali president welcomed an initiative by regional bloc IGAD in seeking a regional strategy to combat COVID-19 that's spreading fast, especially in Africa.
Somalia is vulnerable to health emergency in this scale because of the infancy of its health system and infrastructure, which are only now starting to take shape. We also fully recognizing this and the menacing rates at which the coronavirus is spreading globally and within our own region. I welcome the development of IGAD regional strategy to combat and mitigate this health pandemic.
Meanwhile, local authorities have announced plans to extend restriction measures to public beaches, including Lido Beach, a popular destination for most city residents, in an effort to contain the spread of the virus.
When we return, international news. Global coronavirus cases rise above 1,050,000 deaths. And later, sports. John Mikel Obi sets to join Brazilian club Botafogo.
You are watching ANN.
Whether in your house, at your office, on your phone or online, we are there. We have the facts behind the headlines. We cut to the chase with the news you really need. We cover every angle. We are the bigger, better news network. We are African News Network. ANN. Watch ANN News on MITV from a truly African spirit.
Welcome back. This is ANN News. In international stories, fewer than 1,000 persons have died in the last 24 hours in Spain, but this stands as the country's deadliest today as its number of COVID-19 deaths rises to 10,000. The ongoing coronavirus lockdown in the country is beginning to take a toll as it stirs unrest. More than 100,000 infections have been recorded, with the world's second highest number of fatalities after Italy and third highest tally of cases after the United States and Italy. Spain is struggling to contain the infection amid a strict lockdown that was recently extended for at least another week. Although the mounting death toll brought more grief to the Spanish people, Health Minister Salvador Illa insisted there was a reason for optimism. The global number of coronavirus deaths has risen to 50,000, with more than 1 million confirmed infections. The United States reported the highest daily death toll of any country so far at nearly 1,200, with about 6,000 fatalities. Spain reported a record 951-day number of deaths, bringing its overall toll to about 10,000, a fifth of the world's total number of deaths. Italy recorded 760 more deaths for a total of nearly 14,000. More than 210,000 persons have recovered from the disease, including 9,000 in the U.S. Italy's national lockdown will probably continue beyond the beginning of May. The government has extended the lockdown until the middle of this month. The Trump administration says it is ready to join forces with local officials to advise Americans to wear masks when leaving their houses as COVID-19 cases escalate in the U.S. For the first time, the death toll in the country rose by 1,000 in a single day. A member of President Donald Trump's coronavirus task force, Deborah Burke, says at a White House briefing, the U.S. Centers for Disease Control and Prevention would add a recommendation of masks to guidelines on protective measures in the coming days. U.S. COVID-19 death toll as of Thursday stood at 5,800, with more than 243,000 cases across all 50 states. The Trump administration, CDC, and public health officials have all waved on the issue of face masks since the pandemic broke out, initially telling unhealthy people such measures were unnecessary or even counterproductive. America's stumbling rollout of COVID-19 testing has slowed the nation's response. In the past week, testing has accelerated, and a mix of public and private labs executed more than 100,000 tests per day. Still, experts say the nation's patchwork testing system remains uneven. Many are denied tests to have to wait several days for results. Reporter Nick Harper says this is because the country is short of testing kits.
Drive-thrus are the modern American convenience many people rely on in their daily lives. But in the age of Covid-19, they look a little different. In Washington, D.C., people who've reported symptoms can get tested in a matter of minutes, but it takes 5 days to get the results, and the team here has struggled to get the supplies it needs to stay open.
Everywhere we can, begging friends, going around to the doctors that might have a stash that they're not going to use, asking the labs to bring some more, but good luck with that.
The Trump administration unveiled a new test which gives back results in just 5 minutes. It says that overall, more than 1 million Americans have now been tested. But some experts say that the supply of test kits still needs to be ramped up.
I think one of the lessons that we did not learn from China, nor did Europe, was that while we need scientific and medical expertise, we also need kind of industrial logistics expertise as well to make sure that you get what is needed to those who need it as quickly as possible.
For now, at this test centre, the wait continues for more supplies and faster results.
China has refuted several accusations by U.S. intelligence officials that it concealed the extent of the coronavirus epidemic and underreported the number of COVID-19 cases and deaths. But Chinese Foreign Ministry spokesperson Hua Chunying says these accusations are baseless.
China says it has been transparent about the COVID-19 outbreak in the country, rejecting U.S. allegations that it has concealed the extent of the crisis.
The most qualified judges of international public health security should be the WHO and the relevant medical experts, not politicians with ulterior motives. At a press conference in Geneva, the WHO again refuted the unwarranted accusations against China's figures for lack of transparency. We are very sympathetic to the gravity of the situation in the United States, and we can understand that some people in the U.S. want to be rid of the responsibility. But we do not want to get into any meaningless arguments. The measures taken by the Chinese government have been decisive, timely, and strong. We have worked to the best of our capabilities to protect the lives and welfare of the Chinese people, while buying the world valuable time to stem the pandemic. China has done its best to be open, transparent, and accountable.
If you look at the amount of data that's been put out by many countries, and if you look at the number of peer-reviewed publications that have been made by colleagues from Korea, from Japan, from Singapore, from China, from other parts of China like Hong Kong, there's been a deluge of fantastic, scientifically based, evidence-based publications coming out on a daily basis from colleagues in all of those situations. There have been, I think we had 27, you were saying this morning, Maria, different teleconferences going on today with experts all over the world sharing real-time information with each other, and they all include colleagues from China and colleagues from Asia.
Up next, sports. Mikel set to join Brazilian club Botafogo. Please stay with us.
Welcome back. This is ANN News. In sport, Super Eagles former captain Mikel Obi is on the verge of joining Brazilian club Botafogo. Obi became a free agent after terminating his contract with Turkish club in March because of his coronavirus comments on Instagram. The 32-year-old has been negotiating for a few days with the Rio club, and there is optimism within the board that a new deal could soon be made for the Nigerian. Professional Footballers Association (PFA) have denied blocking wage deferrals for players during the coronavirus stoppage, but said clubs should pay all staff if they could afford it. Professional football in England have been suspended until the end of the month. Player weekly wages, which exceeds many times over what some Britons take home in a year, have become a hot topic as club staff are annoyed under a government job retention scheme. That is ANN News this evening. Thank you for joining us. For details on these and other breaking stories, visit our website, annafrica.news. Conversation continues on our social media platforms, Twitter, Instagram, and Facebook at ANN Africa TV. I am Olajumoke Olatunji. Have a safe weekend. Stay at home and observe social distancing.